Number 20. Chagas. This is another parasitic disease that is a result of the bug defecating on the person, usually in the face area, and this is absorbed through the skin. This is very common in Latin America, where the bug thrives in poorly built huts. Number 19. Leishmaniasis. This is a parasitic disease that is a result of being bitten by a sandfly. It is very common in southern Europe and other subtropic regions. This disease is curable, but in most cases, it leaves behind hideous scars. The disease is categorized as skin lesions that form where bitten. It must be treated by a medical professional in order to relieve the symptoms. Number 18. Smallpox. Once considered to be a rampant disease, this has been eradicated in most Western civilizations via vaccine. However, there are still those who contract this, often located in third world countries and in which vaccines are not readily available for everyone. It is a deadly disease that at one time killed 300 to 400 million throughout the 20th century. Number 17. Weil's disease. This disease is a bacterial disease that is transferred through contaminated water. In most cases, this is the result of living in an area that has livestock urinating or defecating in or near the water used for drinking, eating, and bathing. Most of the cases reported are due to rats being in the water where someone has swam or the like. In most cases, it will cause flu-like symptoms. However, in serious cases in which no medical help is found, it can result in organs failing, resulting in death. Number 16. Morgellons disease. This disease is rare, but it is one of those that is not very well known as to what causes it. Most doctors believe that this is a chronic infectious disease. This disease results in skin lesions from scratching, biting, and crawling sensations along the skin. In addition, it can cause disfigurement in those who have this disease. There is no cure or effective treatment for this disease at this time. Number 15. Bloom syndrome. This disease was first discovered in 1954 and is considered an inherited disease. Those who have this often have a short body frame, they develop rashes on skin that sees the sunlight, have scaly skin rashes, have a high number of infections, may be mildly mentally retarded, and have facial features that are often long noses, prominent ears, and a narrow face. Number 14. Human werewolf syndrome. Human werewolf syndrome is one of those diseases that is found throughout history. It is categorized as having excessive hair growth that is uncontrollable. It can affect both men and women and often runs in families. It is not uncommon for all the children of a person who has this to have the same disease. Number 13. Epidermoplasia versiformis, aka tree man syndrome. This disease is extremely rare and is categorized by tree-like bark growing onto someone's skin. The tree-like substance are actually warts that are made worse by exposure to sunlight. The growths are brought on by the HPV virus, coupled with a weak immune system. The warts can be surgically removed, however, due to the disease, they will continue to come back, resulting in more surgeries to live a normal life. Number 12. Beckwith-Wiedemann syndrome. This disease is developed at or after birth. The disease is often categorized as the child being bigger than average. There are also those children who are born with abdominal wall deformities, a large tongue, and many of these children have trouble eating, swallowing, and sleeping due to these issues. It is very rare, but it still occurs today and can occur anywhere in the world. Number 11. Achondrogenesis congenital disorder. There are 3 types of achondrogenesis. It can either be hereditary or genetic cases, but is considered very rare, and it is not certain as to how this came to be. Its characteristics include deformed bones and cartilage, short limbs, a small body, and other skeletal deformities. Most infants who are born with this die immediately, are stillborn, or live for a very short period of time. Number 10. Kuru. Kuru is found in New Guinea within a specific tribe, making it one disease that is hard for anyone else to get. In fact, in order for a person to contract the disease, they would have to travel to the Foray tribe, find the person who was infected with this disease, then proceed to eat his or her brain. Kuru was first contracted with the ritual of eating the brains of a dead loved one in thoughts that this would bring about their knowledge to the living. Number 9. Field's condition. Field's condition is a rare genetic disease that was named after the Fields twins, who were the first to show signs of this disease. The two twins located in the United Kingdom are confined to a wheelchair due to the fact this disease affects their involuntary muscle movements. This disease can make it hard for everyday tasks such as holding a pencil or fixing one's hair. The disease is so new that research is still ongoing to see just how this is passed and how it develops over time. Number 8. Hutchinson-Gilford progeria. Categorized as a very rare disease, this is affecting around 1 in every 8 million children. This disease causes rapid aging as soon as a child is born. It is categorized as having a large head relative to the size of the body, baldness, limited range of motion, and in most cases, the hardening arteries long before there should be. There are very few people who live with this disease past the age of 20 years old. Number 7. Minamata disease. This disease is caused by mercury poisoning and is categorized by numbness in the hands or feet, loss of vision, damage to hearing and speed, and ataxia. In some cases, it does result in insanity, coma, paralysis, or even death. This was first found in 1956 in Japan, and with the help of the government, it has been greatly decreased due to better mercury containment in place. Number 6. Toxic epidermal necrolysis. This disease is very rare. However, it is often the result of a reaction to drugs that a person has taken that results in the skin beginning to look as pictured. Though it is rare, it is a serious dermatological condition that is also known as Lyle's disease. Number 5. Hemoglobinemia. This rare disease is usually known as the blue skin disorder. Those who have this will find their skin slowly turning blue as they age. This is due to having an abnormal amount of methoglobin in the blood. Most people have less than 1% of methoglobin in their blood. Those who have this disease have anywhere from 10 to 20% in their bloods. This is a genetic trait that can be passed through families. Number 4. Myiasis disease. This disease is an infectious disease that is transferred from parasitic fly larvae to a host's open tissues or through animals in which the human has contact with. The larvae are usually ingested and then it starts to attack the tissue of the host. This can result in severe infection and can ultimately lead to death. Number 3. Elephantiasis. This disease is found in poor overseas countries in which the people do not have access to proper medical care. This disease is often transferred from blood-to-blood contact via mosquitoes in most cases. Once the person is bit, there are often swelling in areas such as the arms and legs. This is considered a parasitic infection. Thus, it is common in poor areas in which healthcare and sanitation are not criteria in the area. With this disorder, the skin begins to thicken and then the limbs to swell. Other names in which this condition is known by is lymphatic filariasis. Though most of the world does consider this to be a rare condition, in South Asia, Africa, and other subtropical regions, this disease affects around 120 million people. The only treatment to stop this disease is through the use of medications in order to kill the parasites that are in the blood. Number 2. Fibrodysplasia ossificans progressiva, aka Stone Man syndrome. With this disease, over time a person will find that their muscles, tendons, and ligaments begin to ossify over time, resulting in the disease being called Stone Man syndrome. This condition affects about 1 in 2 million of those who are born and is considered very rare. But it is also a very serious condition that can result in a person being unable to eat or move once the ossification gets too severe. Number 1. RPI deficiency. Considered to be the rarest disease that is known throughout the world, according to the Journal of Molecular Medicine, RPI deficiency results in the white matter of the brain becoming affected. The only case of this disease to be found happened in 1984. However, it took 15 years for a name to be given to this disease. Thus far, there's only been one case that has been reported, and due to its nature being unknown, there is no way to tell who may contract this next or what aspects go into developing this disease.